We are back with another video on women's health. So at the time of this recording, we have been dealing with the effects of COVID for about 6 months. That's the time that we've been in lockdown. And we thought it would be really helpful and important to talk to you specifically about some of the effects that this lockdown and this pandemic is having on women's health. Dr. Gupta, I'm so happy that you are here to talk to us about this today. I think it's an incredibly important topic. First of all, can you tell us a little bit, just from a high level, how things have been going at your clinic since COVID has hit?
So we've been very, very busy, and the reason I wanted to also talk about this is because I saw some strange effects in women who were themselves COVID survivors. I had a lot of women, as you know, I'm in New York, a lot of women who got COVID, who survived through COVID, and you know, they came out okay, health-wise seemingly, but there were many, many unknown sort of side effects which no one's really talking about. So I wanted to shed light on some of them, just so women are aware that they are not alone, and almost every COVID survivor is showing this.
I'm so glad you're going to talk about sort of not just the effects of us perhaps being in it psychologically in our healthcare, but like what it actually, the impact is on women who have survived COVID.
Exactly.
Yeah. Can you take us through some of those points?
So the top 5 that I've seen: 1, irregular periods. Any stressful event in our life messes up our cycle, but in this case, things have really been thrown off cycle. I've had women who either skipped cycles for over 3 months, or they had very frequent and very heavy cycles, all related to the stressful effects that COVID had on your body. The way it worked is a long process to explain on a short video, but I do want to tell everyone that if you have heavy periods or you're missing periods, first of all, do a urine pregnancy test. Go to your GYN, get an ultrasound, get some hormonal blood work, and then she can help you accordingly. She or he can help you accordingly. Number 2 was hair fall. I've had unbelievably, every single woman who survived COVID is losing her hair in clumps. I don't know if any one of you have lost hair like that during childbirth and maybe after chemotherapy, but that's exactly how it's showing up in women. And again, you're not alone. I've developed a strict regimen of supplements, diet, lifestyle, and exercise, which will definitely help you get over that. It will take time. It'll take about a month or 2 months to even 3 months for your hair to start growing. But this process, every single woman's experiencing who has undergone COVID herself.
Okay, so that's irregular periods and hair loss. You said there were maybe 5. What are the other 3?
Insomnia, inability to sleep, anxiety. Again, every person, and this may be even applicable to men, but in females, definitely, they're like just not able to sleep. Even if they're eating, they're exercising, they're doing fine, but they're just not able to sleep, and they're getting panic attacks or anxiety. It's almost like a post-traumatic stress disorder, call it post-traumatic COVID disorder. And again, it just takes time. I have been giving therapy, meditation, mindfulness tips for those people that will really help. I always suggest trying to go through a shutdown protocol, like after 8 p.m., stop looking at electronic devices, do 1 minute meditation or a mindfulness or a whole body scan. There are many apps for that. And then, you know, don't eat right before going to bed. So little tips like that will definitely help you, but it will pass, as I've seen it happen in my other patients.
Oh, that's reassuring, because that sounds very stressful.
It is, because you have to function too. You know, women are professional and they have to work.
Yeah.
Directly related to this is low sex drive. So when your body is going through some kind of a post-traumatic stress disorder, anxiety, your brain is going into hyperdrive because it's trying to survive and keep your body healthy. It doesn't think about sex.
Oh.
So relationships have been affected anyway because of COVID, lockdown, not lockdown, you know, many complicating factors, but COVID alone has definitely affected sex drive. Same thing, I would recommend mindfulness, meditation, stress relaxation exercises, but also go to your GYN, get hormonal blood work done, get yourself checked out to see if there's something that needs to be fixed.
Great. You hear that, ladies? It's not your fault. It's just part of the healing process. So be good to yourselves, be gentle to yourselves. And the last one, what's the last thing on that list?
Believe it or not, our friends down there who we don't like keep coming back. Recurrent vaginal infections. And it seems like, why should anything be affected down there when I had COVID, you know, elsewhere in the body? Same thing. The stress affects the pH of the vagina adversely, and then you start getting those bad things called BV, the bacterial vaginosis. And I've had every single woman come back with this. So same thing, I help them treat with the antibiotics first, but then you have to heal your body with good, healthy diet, probiotics, heal the vagina, no, you know, panty liners and all those things, but inner health reflects in vaginal health.
Okay. Well, thank you, Dr. Gupta. That's good to know. It's good to be aware of so that we are not extra hard on ourselves. We certainly don't need to put any more pressure on ourselves. So what you've told us that, especially for survivors of COVID, they may experience irregular periods, hair loss, insomnia, low sex drive, and recurring vaginal infections. It's not easy. It's a lot to deal with, but luckily we have you, and we're going to put a link to Dr. Gupta's tips on how to deal with these symptoms and problems if you're experiencing them down in our notes. Please comment if you have any questions, and thanks for spending some time with us. Thank you, Dr. Gupta.
Yeah, and thank you. And remember, you're not alone. Take care.